Hello, this FERNE educational video discusses the treatment of emergency department patients with dizziness and vertigo in an attempt to successfully diagnose and treat serious central etiologies. We're going to talk now about the outcome of the patient with dizziness and vertigo. My name is Ed Sloan from FERNE.org. More on FERNE to follow. So what is the outcome of the patient we presented? This is a 44-year-old dizzy male. The sign out from one emergency physician to the other was just check the CT. It's a 44-year-old male, history of hypertension, diabetes. He had 6 hours of continuous dizziness, and this sounds like acute vestibular syndrome. He was a little unsteady on his feet. He said he felt like he's a little drunk. The patient has normal vitals. He has some left beating nystagmus with gaze, and he preferentially gazed a little bit toward the left. But all of this resolved with treatment with benzodiazepines. And so the one provider said, look, if the CT is okay, he can go home with meclizine. And of course, with the sign out, just check the CT is negative, but is the patient really clear to go? The patient seemed to have some decreased auditory acuity on the left, and when standing up had a little mild wide-based gait consistent with some ataxic gait. So the patient was admitted. His initial MR-DWI was negative, but subsequent MR-DWI at 72 hours was positive for a posterior stroke. And in fact, you can see there's right basilar occlusion with posterior stroke findings that you see here on MR, here, and some brainstem involvement. And as a matter of fact, the arrow shows an acute basilar thrombus on CT. So what are we talking about? Posterior circulation occlusions can occur anywhere, either at the site of the posterior inferior cerebellar artery, the posterior cerebral artery occlusion, and pontine perforating arteries that supply areas of the pons in the brainstem. So what did the patient have? Acute vestibular syndrome, AVS, evidence of a likely vertebro-basilar system posterior stroke that involved posterior circulation tissues, the thalamus, the brainstem, the occipital lobes, and can also at times involve the temporal and parietal lobes. So anytime you have posterior circulation issues, the outcome can be devastating. And again, we'll talk about those areas that can be involved: cortical regions, including the temporal and parietal lobes, the thalamus, the occipital lobes, the brainstem, and the cerebellum. All of these can be disrupted if there's an occlusion in the posterior circulation, the vertebro-basilar arteries. So, is the vertical central? What are the take-home ideas? Well, you need to know the attest system that was addressed in the monograph by Dr. Edlow. We need to know what's involved with the HINTS++ exam. We need to exclude anterior stroke signs and symptoms. If a patient is to be sent home, we need to make sure the patient can walk, talk, see, hear, feel, and swallow. We need to observe the patient walking out of the emergency department. We need to document using templates. And we need to give specific return symptoms in our discharge instructions that would detail what the patient might encounter if there truly are posterior stroke signs or symptoms. Again, my name is Ed Sloan. I'm the FERNE President and Board Chair. I have no financial conflicts. Please go to our FERNE.org website and our YouTube channel for more content related to the optimal care of the patient with dizziness and vertigo. Follow us on social media for more real-time information on the care of all patients with neurological illnesses, injuries, and emergencies, FERNE.org. And if you have any comments or questions, please email us at FERNE.org@gmail.com. Thank you and have a good day.